Good evening, everyone, and welcome to our edition of our patient health workshop. And it's good to have you all here. We're off to a bit of a latish start, but we should be able to get us done somewhere close to the other side of 7 o'clock, so it should not be too long. Before we get going, I just want to confirm that you can all hear me okay. So please, if you can hear, just indicate in the chat that you can hear, and as long as one person can hear, then my settings are okay. So if one person says they can hear me good and nobody else can hear me well, check your settings. All right. So I just wait for that response and then we shall begin. Okay. Thank you, Karen. And on the strength of the lone voice, let us begin. Um, as we get started, I'm just gonna bring up the our PowerPoint so that we can follow along. And the title of our presentation is The 7 Keys to Getting and Staying Well. The 7 keys to getting and staying well. And the goal of our presentation is really educational, informational, in a way that hopefully will help you to make choices that are beneficial for yourself and your family as it relates to health. And so I'll try to stay away from too much controversies. Um, Sometimes it's difficult for me, but I will try this evening to not get into too many topics that are, hot button topics, unless it is that it's something that somebody has a legit question about that they want to have clarification on, and I'll try to offer some clarification if there's any such question. But the situation as it is for me is that I want people to make good choices so that they can be healthy. I want them to make good choices so that their families can be healthy, in particular their children. Sometimes, because of ignorance of um, parents, children end up suffering because parents make bad choices. They make bad choices not because of an act of will or a failure on their part of will, but because they are misguided in their thinking. They're misguided in terms of um, their understanding of how things work. And because they have a wrong understanding, they are allowed to be taken advantage of, is I guess the simplest way to put it. And then they end up making a choice that may end up harming their child or harming themselves. For me, I don't want that to happen to any of my patients, so I do the best I can to share information that will help to kind of put you in a place where it's hard for anyone to take advantage of you, even myself, right? And I do not want anyone to take my word for it for anything that I say. Investigate it yourself. If you have people who you trust, run it by them, hear what they have to say. If anybody has a question or a challenge for anything I say, feel free to comment, put it in the comments. The only thing we're gonna ask is that these comments be um, treated in the most professional manner, and so I don't want to have to, kick anybody off or block anybody from being able to comment. But if you have a question or a comment that you'd like to make, feel free to make it, as long as it's not belittling any individual or maligning anyone's character. We don't want to do that. All right. So it's good to be here. Let us see who we have here on this live, shall we? So, Karen, welcome, welcome, welcome. Hugh Gordon, welcome. Annette, Roxanne, Auntie Edna, Devoree, Cheryl, Glenton, and of course Auntie Garnetto. Not to forget you. Welcome, welcome, welcome. Niconelia, welcome as well. Welcome. Wow, what can I say? It's good that you're here. Now, there's a handout that I want you guys to download. I've indicated it before. It is in the comment section. I'm going to pin that comment now. I'm going to pin that comment so that those of you who would like to download the handout for the class, you may be able to do that. And this is a handout that I have behind me. The good news for you is that your handout is a completed handout. The blanks have already been filled in. So you are good to go where that is concerned. Anyone has any difficulties, let me know, right? Oh, Georgette, I left you out. Hello, Georgette. Welcome to our presentation tonight, and you are welcome to be here. So, sorry that I did that. Sorry that I did that. All right, so let us begin, shall we? So the topic is the 7 keys to getting and staying well. And the first key is understanding the difference between sick care versus healthcare. Sick care versus healthcare. And please understand that when I talk about sick care as it relates to the healthcare system, I'm really using descriptive terms, not intended to be derogatory in any way, right? Because I do call the current healthcare system a sick care system. And the reason I do that is not because it's anything less than, but because it primarily focuses on caring for those who are sick, right? And as you know, whoever your primary target audience is, or your primary market member is, then that is how your policies end up being sorted through. So if you're primarily dealing with blind people, then you'll find that your policies and procedures will center around blind people. If you're primarily focusing on those who are sick, then you'll find that your practices, your policies, your procedures will be centered around sick persons. And so the caring of the persons in the healthcare system as it currently exists is one where the primary person who goes to access service from the healthcare system are those who are already sick. They already have some disease or some condition for which they are seeking help. And they believe that that system is there to be that source of help. And so that's what that is about, right? That's what I mean when I say sick care system. But there's a challenge with dealing with things in that way. Because in order for you, if it is that you're waiting for somebody to be sick so that you can help them, then you're always trying to play catch up. Meaning that if it is that the only way I can help somebody is by first observing that they have an issue, a disease, an illness, an accident, trauma, something that I need to now intervene on. This is something that puts me a little bit behind the event. So the limitation of that, or the problem with that, is that if you wait until something has gone wrong with somebody first before you attempt to do any treatment or any intervention or any remedies, then you will find that there are some things that people will come down with, or some people will have, that there's no treatment for it. Or you may find that some people may have an ailment and they may end up dying from that ailment before you can properly help them. Or they may end up with a situation that they have that robs them of good quality of life because they have it. Now, there are some diseases that people have that will make them really, really compromise their quality of life considerably. Some diseases, some illnesses, for example, may cause you not just to have pain, but it may end up causing you to lose a body part. My father had cancer in 1998. He was diagnosed and he had his leg amputated, and as a result of that amputation, he now has one leg. If we knew how to prevent the cancer from coming in the first place, then he wouldn't have had that situation, right? So we want to try to catch people when they're as healthy as possible, as close as possible to optimal health, so that we can prevent them from shifting all the way down to ill health. And that is what, my focus is about. That's what I try to achieve even in my own practice when I deal with my patients. Georgia, you can use the smiley face function so I know that you're smiling too. All right. Let me see if I can add. Ooh, ooh. What did I just do? All right, so let's continue, shall we? So the problem with that model is that you're always waiting for something to go wrong first, and so because of that, we say that system is a reactive system. Something has to happen, and then they healthy. We can't simply operate in that way. What we will need to do is to operate in a slightly different way. The way that we would prefer to operate is one in which we prevent things from happening in the first place. So we have to be more proactive in our approach. That is key. Being proactive in our approach. All right. Now, the next thing is we have a problem with the healthcare system as it currently exists. And the problem that we have with the system is that it is a broken system. It's a system that is doomed to failure. And this is my opinion, yes, but it is based on how I observe things to be. And I'll tell you why I say it's doomed to failure. It's a necessary system, but if people keep using it for optimizing their health, it's going to fail. Here's what's happening in our system. Very little is being done to prevent illness in the first place. And that's how that model is set up. It is designed to manage people in their state of disease. It's not designed to prevent people from getting sick. Because if you prevent people from getting sick, then they won't need medications, they won't need surgeries, they won't need hospital stays, they won't need any of that. And so the system stands to lose a lot of money. So it is not necessarily in the financial best interest of the medical industry, if you will, for people to be taught how to remain healthy. Instead, we tell people that if you have diabetes, nutrition can't help you. So the only savior that you have is some medication that you'll have to take for the rest of your life. Now, every time I hear a physician say that, speaking of some medication, some nutritional supplement of some kind, they say something like, oh, there's no research to support it. or I don't know of any research that says that that works or anything, it irks me quite a bit. And it irks me quite a bit because it's disingenuous. It's misleading the people into thinking that food somehow or supplements somehow is less effective. Uh-oh, sorry guys. Um I've been ranting along and the volume was off. So let me try that again, right? The issue with the system that is the way that the system is set up against um, the supplements that people take, it gives the impression that supplements somehow are less effective at getting people healthy, and medication is the only way to get people healthy. When our medical doctors know full well that medications offer no benefit for the person's long term health, what it does is that it maintains a person in their state of disease, safe and apart from antibiotics, things of that nature, which are really designed to try to eradicate a pathogen or some germ that's causing an illness. So if you are able to eradicate it, then the illness will go away and the person will restore their health. But apart from that, and I do not put vaccines in the same category as I would say antibiotics, because that's a whole other convoluted story. I wouldn't want to necessarily go into that too much, other than to say that what many people believe to be true about vaccines is really based on clever marketing and significant dollars being spent to push a narrative that's not necessarily as truthful as one would think, even when you look at the historic evidence or information that is put forward or the current benefits that are suggested. It's not what people think. But I don't want to go down that road too much, right? Um, the number one reason that people are sick in the first place is primarily because um, we have poor lifestyle choices. And these poor lifestyle choices are the main reasons for persons getting sick in the first place. Um, Dennis is asking a question here in the comments. He asked the question, what is my opinion on British osteopathy? Um, Now, osteopathy is very similar to chiropractic in that an osteopath also will manipulate the spine in their approach to achieving good health. The biggest difference between a chiropractor and an osteopath is a philosophical difference, meaning that chiropractors are typically non-medicinal in our approach. Osteopaths have been assimilated into the mainstream med rights, meaning that they can write prescriptions, which some of them do. But chiropractors are not, we're not about that, right? For the most part. Although there might be some benefits to being able to do that, because the fact that I can't write prescriptions, it means that I can't, if I think that somebody needs to get off a medication, I can't take them off the medication, right? So there's an advantage that an osteopath would have over me in that regard, because if they see that a medication is dangerous or harmful to a patient, they can take them off too, because they have prescription rights, which we do not. So I think osteopathy is a noble profession, a good profession, and it will offer a lot of benefits to individuals. So that's my 2 cents on that, Dennis. Thanks for the question. All right. Moving forward, though, we're talking about the main reason that people are even sick in the first place is because of drugs and surgery. It's because of lifestyle choices. That's why people are ill now, because they make poor choices as far as how they live their lives, and as a result of that, they end up getting sick. Now, the main type of illness that are cared for in a hospital setting are those chronic, non-communicable diseases. These are like diabetes, hypertension, high cholesterol, heart disease. These are all lifestyle diseases, meaning that the choices that you make in terms of how you live, eat, and breathe do impact the way in which you are able to maintain yourself in a good state of health. Now, I've long realized that if you want to change the way people think about anything, or the way people behave rather, you have to focus on trying to get them to think differently. It's almost impossible to change your behavior or your habits while you maintain your same level of thinking that you had when you started those habits, right? If you want to overcome poor habits with better choices in life, you have to change the way you view life. So the way you think will impact the way you behave. And as a consequence of that, I've tried to break down the way mainstream medicine teaches people to think, and the way I would say natural healers will want you to think. Because as a chiropractor, we believe that the body is a self-healing, self-regulating organism, meaning that it heals itself. Healing comes from inside out, not from outside in. So it's not from a potion or a lotion that makes you well. Wellness comes from inside you. So if your body is in a state of ease, good ease, then it will be able to stave off or ward off dis-ease or disease. And so that's what we try to do for persons. Now, I'm going to try to show you 3 big categories under which different people will think, and show you the way that the mainstream tries to get you to think and how I would hope that you would think, right? So here we go. Have you noticed that if something has gone wrong, like let's say you're in pain or something has happened, have you noticed that most of the time the first thought that comes to one's mind is, what can I take to feel better? You know, you have a little pain, and I hear it all the time. People come to my office and I do my examination, I tell them what I'm going to do as far as treatment, and then the very next question that they ask is, so doc, you don't have anything to give me for the pain? Even after I've explained to them that what I'm going to try to do for them is to restore their body's normal function so that they can heal themselves and get rid of whatever it is that's causing the pain. They are not interested in that. Doc, all I really want, is something to ease the pain. And I've actually had to tell persons because I know what is going to happen down the road, right? If somebody comes to me and they say, all I want is something to ease the pain. I don't care about you realigning my spine or you doing this or that. All I want is somebody to ease the pain. It's not going to work out well for both of us because that's not what I believe is the best thing to do for you. And if you believe that if that's what you think that you need, then what you need to do is find the doctor who's going to do that for you. But if you come to me and I don't offer that, it's going to stress you out. It's going to stress you out. Yeah, so it's not going to work out well. And I've had to actually say virtually that to some persons in the past. So I don't want people to be stressed out. I want them to get a good experience from what they do. And so you have to match what you want with what can be done, right? So that's how I look at things. Now, feeling better cannot be the ultimate goal. Want to take something to feel better, right? A more important goal is what do I need to do in order to get better? Because getting better is really where it's at. You don't want to just feel better. As a matter of fact, there are many things that people can take medicinally that helps you to feel better without doing anything to improve your actual health status. The only difference is that you feel a little better. But you're still suffering from the same illnesses or the same conditions. It's just that we're able to manipulate how people feel. Feelings is never a good thing. If you live your life based on feelings, you're setting yourself up to be manipulated by those who know how to control how you feel. And that is true. How about this? Getting well. Some persons say all the time, you know what? I hope to get well. Or you go to the hospital and somebody sing and say, get sick, and you say to them, get well soon. When you say get well soon, what you're saying is that you're wishing or hoping. It's a fantasy, it's a dream, it's a wish, it's a desire that they be well. When the reality is that wellness is not about a destination. It's not something to arrive at. Wellness is about the process. It's about the journey. It's a journey of approaching wellness. So it is, instead of saying, what do I need to do to get well? You ask, what do I need to do in order to stay well? Because it's a journey that's important. And as long as you're on that wellness journey, you are going to continue to improve and you're going to continue to be better than you were before. And that's really what it's about. Staying alive is the measure by which many people assess the health of a population as far as it relates to how good the system is doing, the healthcare system. When how long people live is not really a measure of how healthy the society is. Yes, there is some association between the two, but you can actually improve or increase life expectancy in a population without making people live older. Generally, So you say life expectancy in a population is 70 and the life expectancy in a different population is 80. And you are going to conclude, because of that, it means therefore that the people in the first population are living to be older than the people in the second, the people in the second population are living to be older than the people in the first population. And it will seem straightforward, but it actually is not that straightforward. Because the way the measurement for life expectancy goes is that with life expectancy, you take into account the total population and the ages at which the total number of people die divided by the total population size. So you add up everybody's age at death for the entire population. If you had a baby dying at 0 years and you had a baby dying at 1 year, you had children dying at 5 years, you had adults dying at 28 years, dying at Okay. I I'm apologizing again for the break in transmission. As long as I catch it as it happens, I'm okay. We won't miss too much, right? So let's continue. So you have adults dying in their 20s, 30s, 50s, 60s, 90s, over 100. You add up their total ages, you divide it by the total population size, and you end up with the life expectancy of the population. Some It's a little bit more technical than that, but that's somewhat what we work with. Now, if I have a population of people, and for every 10 people, one baby dies at birth, or dies soon after birth, or dies as a 2-month old, and then having the other population, very few babies, maybe 1 in 100 babies dying in infancy, then what ends up happening is this: that baby whose life you've saved from dying as an infant, may end up to live to be 70 years old. So for that baby, you've added 7 decades to that baby's life. Whereas if you're trying to get old people to live even longer than they have, you might have somebody who is 75, and you change some things about their health and they live to be 80. You've only added, which is a significant change by the way, but you've only added 5 years to that individual's lifespan. And so the best way to impact life expectancy is by allowing babies to survive infancy. If you can do that, your life expectancy numbers will be very high. So when you see these countries that have high life expectancy numbers, the first thing you should think is, it means that their infants are not dying in childhood, or their infants are not dying as an infant. They are living and surviving infancy, and so they are able to go forward. Right? So this is the situation that we are bound with. So rather than looking at how long people live as a measure of the effectiveness of the healthcare system as far as keeping people healthy, a better way of measuring it would be feeling alive. How well do you feel while you're living? It's the quality of life that is important. And so that is the difference. It's just staying alive, feeling alive, and that is the key. All right, we're gonna move forward now. I'm gonna pick up the pace a little bit. Hopefully there are no more breaks in transmission. So let's go. The second key is understanding the truth about pain. Is pain a good thing or a bad thing? Is pain a good thing or a bad thing? Now, many people will understand right away that irrespective of whether good or bad, pain has a purpose. It has a function, and the function of pain is to alert us that something has happened and needs our attention. That is the purpose of pain. Now, here's the interesting thing: pain has limitations. Many people think that pain is a good measure to tell you when something is wrong, and so they trust pain to be that guide for them. But the problem is that pain is not a good guide to tell you when something is wrong. It does tell you when something is wrong, but it's not a good guide because of several reasons. One, you can have a problem like cancer and there's no pain associated with it. So there are many people with like breast cancer and so on, and they don't really have any pain. They just get weaker and weaker until they're dying. Some people will have pain in the very later stages, but by then they've already been diseased for so long, and pain failed to warn them that they had this going on. There are many conditions that you have zero symptoms of it, like hypertension, which they call the silent killer. There's no pain associated with hypertension. In fact, there are many people who would say that, I felt some pain, and when I checked my blood pressure, indeed it was high, thinking that it is the blood pressure that's causing their pain. When in fact, it's the other way around. If you are in pain, your blood pressure will go up because your body is perceived to be in a stressed state. And when you're stressed, your pressure increases. This is a normal physiological response of the body. If you are stressed, your blood pressure rises. That's why if you go to a doctor's office and take your blood pressure, for many people, it's a high blood pressure because they're nervous about the blood pressure reading when they go to the doctor. So when you're in pain, you are going to be stressed. So if you're in pain and you take your blood pressure, chances are it's going to be high. But it's not necessarily true. That is the pain that caused the pressure. That's the pressure that caused the pain to be there. But many people make that association and say, you know what? When I have this pain, I know that it's because of pressure high. Something to think about. Now, other thing so you can't trust pain to tell you when something is wrong, because feeling good and having good health are not the same thing. In order for you to know if you have good health, you have to be checking the functions of the body to make sure everything is working the way they're supposed to be working, and that is the key. So we need to start trusting the way our body is working and not simply how it's feeling. Now, there are different systems of the body, and I'm going to point out a couple important things, so please pay attention. In the systems of the body, they all communicate with each other to some degree. There's no system that works in total isolation by itself compared to the other systems of the body. No system is in complete isolation all by itself. Every system has to depend on or interact with another system. However, there is one system that not only corresponds or coordinates or communicates with the other systems, but it does so with all the other systems, and it also regulates the function of all of these systems as well. Which one of the systems does that? The nervous system. Our nervous system is that master control system, which brings us to the third key. The nervous system is the master control system of the body. Spinal manipulations or spinal misalignments are known to cause interference to the nervous system, because the nerves that travel between the spine can be interfered with as the bones are misaligned or out of place. Sometimes it's the bone themselves that cause the irritation of the nerve, and sometimes it's the cartilage between the bones that cause the irritation of the nerves. We call a misalignment of the spine a vertebral, because it's the spine, subluxation, which means less than a dislocation. So vertebral subluxation is an alignment of the spine that's not quite a dislocation. This is what chiropractors work on. This is how we, make our living helping people. Because when I examine you, I want to see whether or not there is any evidence that there is anything like that going on for you. And if it is happening, how does it relate to what you are experiencing? Right? Because if you have an issue in your body and you are able to find out what is behind it, then you have a much better chance of addressing the issue. And that's why chiropractors do what we do. In fact, if you have an issue and we assess you and we find that the nerves or the area where you have a spinal misalignment corresponds to the issue that you're having, then it's a very high likelihood that if we are able to correct that misalignment, that the issue that you have will improve. Sometimes go away. So that is important to note. So I'm going to try to show you something here. This is a chart that shows you the alignment of the spine. And as we look at the alignment of the spine, what we see is that the middle bone, this bone right here, is not lined up with the bones above it or below it. And so the openings where all the nerves exit are not as wide as it should be because of that misalignment. Whatever it is that this nerve controls will no longer work as well as it should because of that misalignment issue. This is what we do with a chiropractic adjustment is that we are trying to reposition this displaced bone so that we can maximize the opening for the nerves to pass so that it can pass unimpeded. And that is important. Now, key number 4 says that lifestyle stress causes subluxations to occur. And there are 3 dimensions of stress that we experience. One is the physical. For example, a fall or a car accident is an example of a physical stress, something that causes physical trauma. A biochemical stressor, something like a toxin that we ingest, or a chemical that goes into our bodies, or what we eat, drink, or breathe, or something that we put onto our skin. These are all biochemical stressors. And then a psychological stressor is something that happens to us that impacts how our brains perceive our reality. For example, we might be in a job that doesn't, where the boss doesn't treat us well, and so we're frustrated, and so that frustration leads us to be developing illnesses. So it's important that we understand these things, right? There are physical, biochemical, and psychological types of stresses that we will encounter. Now, when we correct spinal issues, people, the work that we do will impact the function of the nerves because the nerves travel between the spine, and if the spine is out of place, it may potentially irritate the nerve. And that's not what we want. We want the nerves to be healthy and free. So we use an example of a general adaptive potential, also called a gap, to explain how this happens and why we get sick. So when you look at any gap, a gap will have one boundary on one side and another boundary, and the space between them is a gap. So in our example here, you have a lower limit and an upper limit, and the space between them is that gap. The higher up you go is the healthier you are, the more vital you are. That's vitality, optimal health, the wider the gap. If the gap narrows to where the upper limit goes down to almost the lower limit, then as it narrows, the gap is decreasing and you are failing. The more it decreases is the closer you get to death, because at death you are no longer able to adapt to your environment at all. There are 3 types of things, or the thing that we want to try to overcome is our external stressors in our environment. We talked about the different types of stresses that we will encounter. So we want to try to eliminate or overcome the external stressors in our environment if we want to stay healthy. The only thing that we have to be able to do that is our own internal resistance. Our internal resistance is the only thing that we have that can improve our ability to withstand the stresses that we are facing. When you sleep, eat well, are in a happy state, and get chiropractic adjustments, your body's going to be in a happier state, a healthier state, and your resistance is going to be high. You will be able to oppose stressors in your environment a lot better. When you look at our life experiences, as long as that they're within the boundaries of our gap, we do not break down, we do not get sick. However, if our upper limit should fall, meaning that our external stressors have eroded away at our internal resistance to the degree that our stress levels now, our resistance now goes down to some level, then things that we were once able to oppose or resist, we may no longer be able to oppose them. And so that's where we start to break down. For some persons, it might be cancer. For some people, it might be diabetes. It might be hypertension. It might be high cholesterol, whatever it is. But whatever it is, the lower our limit is, our upper limit is the more likely we are to get sick. So in our office, and this is the sixth key, the penultimate key, is identifying subluxations wherever and whenever they occur. Now, we talked about a subluxation being a misaligned vertebra. And if we are able to identify when they happen, then we can try to make changes before the subluxation starts to impact our health in a negative way. In fact, it takes about 6 weeks from the time that a nerve is being compressed to when the tissue that nerve controls or regulates starts to change its cell structure in response to the injury to the tissue, to the nerve. So if your nerve goes to your bladder and you irritate that nerve, then the bladder will show changes after time. What we want to do is to try to stop these changes from happening before they do happen. So to identify if there's an issue in your system, we employ the use of technology. We have a device called a subluxation station, and this subluxation station will allow us to be able to measure different ways that the spine might not be working how it should. The first one is using this device on the left. It's called a rolling thermograph, which measures the temperature of the skin on each side of the spine. And then the one on the right is the surface EMG, measuring the muscle activities of the spine. Armed with those two pieces of information, we are able to now make choices that can assist the person getting better. Remember, we don't just want people to feel better, we want people to get better, right? So people ask all the time, what kind of doctor is a chiropractor? And does chiropractic even work? Right? So there's a nice little study that was done to see if chiropractic works. And in this particular study, the lady was asked to wiggle her left ankle, and they took a picture of her brain before the adjustment and after the adjustment. The diagram on the left shows areas of, let me zoom in a little bit because I want you to be able to see this a little bit more clearly. The diagram on the left represents the activity of the brain before the adjustments, and each of these lights that you see all over the place are areas where the activity of the brain is at a very high level. Well, this brain is having way too much excitation all over the place for a simple task of wiggling the left ankle. Well, she was given an adjustment and the task repeated, and this is what the brain MRI, functional MRI, showed. It showed fewer areas of activity on the right hand side of the brain, which corresponds to the left side of the. This is a much more efficient spine. And this one is after the adjustment. So you can see that the adjustment does indeed make a difference. Now, what kind of doctor is a chiropractor? Chiropractors are not bone doctors. We are nervous system doctors because the work that we do impacts the nervous system way more than it impacts the bone. And that's important to note. Now, I'm a chiropractic neurologist, and it's a subspecialty within chiropractic. All chiropractors are trained to realign the spine. A chiropractic neurologist also has knowledge about retraining the brain itself. And these are things that we do in our office to assist persons with different types of issues. These are examples of conditions that I have personally treated in my office here. And of course, with varying amounts of success, varying degrees of success. Our vision at Gardner Chiropractic is to identify subluxations wherever and whenever they happen, to provide a program of chiropractic care for persons to try to restore them back to good health. And a program of care is broken up into different phases, and each phase typically is about 12 sessions long. And what we do is we do a series of 12 visits and then we reassess to compare before and after. As long as you keep improving, we keep continuing or suggesting that we continue your treatments until we get to the maximum benefit that you're going to get from it. So that's a good one. That's how we try to do what we do. We also try to educate our community, and we educate our community in different ways. This is one such way. Another way is by having our radio program online or on the air at RJR 94 FM, and we also stream it on Facebook. In fact, I'm gonna give you in the chat section, in the comment section, our Facebook link. Hold on a second. Back to health. Talk show. Alright, so I've just included the link to our Facebook page for the radio program that we have every Tuesday night at 8 p.m. Jamaica time. Feel free to tune in because it's very informative, I think at least. Now, the key to getting and staying well is for you to take responsibility for your health. It's for all of us to take responsibility for our health. Sometimes we make such poor choices that if we follow this system, we're going to be in a very sick state after several years. the show that we had just the other day on Tuesday on the radio program was GERD, and we looked at the regular treatments medicinally for GERD, acid reflux. And what we concluded in that show was that because the medication stops acid from being formed, and acid is required for you to be able to absorb many nutrients in your stomach, minerals, proteins, and so on. These all require an acidic environment in order to function. So when you take antacids, you're not able to extract nutrients from these types of foods, and this is why people get sick. And so I encourage you to look at that, watch that show if you get a chance. It is really sad to see what people end up doing to themselves just because they want to be healthy. I have some video testimonials online. I'm inviting you to check them out. Just go to Gardner Chiropractic page and look in our video section, and you should see these. Most of them are still there. Now, for those of you who have made it to this point, I have a special offer that we'd like to make. And your name has to be written in the comment section for me to know that you actually observed and participated in the class. Not necessarily participated, but at least watch the class, right? Alright, so here's the offer. For those of you who do not yet or have not yet seen me as a patient, then you qualify for this discount. Now, the interesting thing about it though is that even if you already have an appointment, if you have not yet come in, and as at today, having watched this presentation, then you will get a special discount for when you turn up. So this is an offer that's made to you or to anybody who wants to now make an appointment having gotten this offer. Just bearing in mind that appointments do take a long time to come around, but they do come around. And we just hope that you don't end up waiting for months and then end up missing your appointment for some unavoidable thing. Hopefully you'll be able to come through. So here we go. You will get a 40% discount off your new patient examination and neurospinal scan fees. Whatever that cost is, you get 40% right off the top discount. So you only pay the rest. And that's a pretty good discount. All you have to do is just indicate to them that you were in the class and that you commented, and we are able to verify that when we look at the stream results, the comment section. But here we go as well. If you are an existing patient, meaning that you've already done your new patient exam, I've already written up a treatment plan for you, and you may or may not yet have already started your treatments, then this applies to you. Not only will you get a 20% discount off your update examination fee for well, plus you will also get a 20% discount off one treatment per person that you refer. So if you refer 5 people, you'll get 5 one treatment discount. Meaning that if it's 5 people that you refer, 20% discount will be 1 free treatment. So that's basically how you can think about it. Either you can apply it to separate treatments and get 20% off each, or you just apply them all to the same and get a bigger discount. It's not restricted in that way. And the last thing is you will also receive a discount off your entire next phase of care. So you'll get a 10% discount off your next phase of care if you are an existing patient that has watched this class. Now, if you're a repeat watcher, meaning that you've watched it already and you've gotten these discounts applied already, you're not going to get these discounts applied again. Just this is a one-time deal. The only one that's recurrent is the referral discount, where every time you refer somebody, you get a 20%. They get a 20% off the new patient exam. You get a 20% off your treatment, right? So this is basically what that is. So when we look at our information here, you can see some background information for us, how you can link up with us or follow us. We have a Facebook page, a YouTube channel, one for the radio talk show, and our website. So please follow us and let's see if we can make a difference to the world around us. So those are the 7 keys to getting and staying well. It is my hope that it was of some benefit to you, that the information that you heard was meaningful. If it wasn't, you can always feel free to leave a comment in the chat section so that we know how we can improve. But I really appreciated spending the time with you this evening, and I hope that we will be able in the future to continue to help you on your path to restoration of health in your body. Getting some feedbacks coming in. Some persons are saying that they enjoyed the session. I'm grateful for that. Thank you for that. But make sure, guys, that your name is in the chat. That's how we'll know that you participated. So thank you, Georgette. Thank you, Devery. Thank you, Shirley Walker. Good session. Thank you. Appreciate that. Thank you very much, Devery, again. And thank you so much, Valerie. You know, if you would like us to do more things like these, my time is already so busy, but if you have an idea that you'd like to see me do, you can always mention it. If it has a buzz, you know, you never know. I might be intrigued enough to do it, despite being as busy as I am. But thank you guys for being able to participate. Thank you, Auntie Charmaine. Blessings to all of you. And I look forward to spending more time again with you in the future. May God bless and keep you. Have a good night.